In this presentation, we will discuss augmented reality and how it can potentially benefit surgeons. How does surgical planning happen today? Currently, images are reviewed with radiologists, in a surgical planning conference, or independently by the surgeon. Intraoperative review of images can be cumbersome and time-consuming. This is in part because images themselves are displayed on two-dimensional stacks. These are reviewed by a radiologist and a report is generated. The challenge is, while a CT scan contains vast amounts of information about anatomy, vessels, and tumors and their relation to one another, this information does not translate well to the realities of surgery. The three-dimensional appearance of organs and tumors is much different than the two-dimensional representation seen on a CT scan. So how can we get the most from our imaging? What about 3D printing? 3D printing is a revolutionary new technology that allows high-definition printing of models. However, there are drawbacks. 3D printing is costly. There are physical constraints related to the size of the models. This is not reimbursable by insurance, and there can be long turnaround times. What about augmented reality? The first question to ask is, what is augmented reality? Is this something out of science fiction? No. Augmented reality differs in specific and important ways from its cousin virtual reality. In virtual reality, the user is immersed in a completely digital environment. With augmented reality, users are able to experience the real world with digital information overlaid on their experience. The Microsoft HoloLens is a device for augmented reality. This device uses microdisplays to display images onto a waveguide. This waveguide projects these images into the user's eyes and projects a virtual hologram. While not a hologram by the exact definition, the user experiences it as such. With the augmented reality solution, the technology of augmented reality can help educate patients, help surgeons better understand complicated anatomy, and roadmap surgeries prior to operation. The following is an example of an augmented reality application. A child with a right kidney tumor has been scanned. This information was processed in 3D into an augmented reality application. Just below the surface is the large right kidney tumor in blue, just underneath the bowel. If we look a little deeper, we can see the green right kidney being pushed and compressed, and even the red feeding artery supplying the tumor. Contrast this to the appearance of the same patient on the two-dimensional CT images. When scrolling through the images, we can see the same information, but it is striking how different this appears from the actual three-dimensional appearance. Even if we were to project this in a coronal plane, while it gives a better sense of the overall relation of the anatomy, it is still quite different from the three-dimensional appearance on the holographic projection. We can see an example of the right renal feeding artery both on the CT scan and three-dimensionally as we look through the surface and into the tumor itself, with a large feeding artery supplying it. In summary, augmented reality offers the potential of patient-specific models, quick turnaround time, can be used with CT or MRI data, and is a rapidly growing field with many technological advances. In this